So a scar is just is fibrous tissue. It's just really your body's response to wound or injury. And it's a process that kind of heals the skin, and it's a normal process, but whenever the skin is damaged, it tends to leave a residual sign from that injury, and the scar is that fibrous tissue. Anyone with a scar they don't like is a good candidate for Fraxel Laser. So patients post C-section, post-surgical scar, acne scars are all candidates for the Fraxel procedure. We're seeing more and more patients with C-sections coming in wanting to introduce something about the scar. We can see patients as early as 3 months post C-section, but a lot of our patients had C-sections 10 or 20 years ago, so it's important for them to know that there's no window where it's too late, but at least 3 months after the C-section procedure. The most important thing after the C-section is to prevent a scab from forming on the wound. We do that by either applying Aquaphor ointment or Vaseline ointment. What that does is kind of moisturizes the wounds, and it prevents the scab from forming. We used to think scabs were good for wound healing, but now we've learned they're bad for wound healing, and they slow wound healing. Second thing is to avoid strenuous activity immediately after the procedure. If you do a lot of activity, it can stretch the scar, which is poor for wound healing. Around 3 months after the C-section, we recommend using a topical ointment. SILICONE actually has the best evidence that it can help with scar revision. So starting with either a silicone gel or a silicone sheeting around 3 months after the treatment is recommended. After 3 months, the scar is going to be mature, so there's not much you can do except sun protection. This is an area that tends to not get sun exposure, but if you happen to be someone who gets sun exposure in this area, an SPF of 30 or higher is recommended. So the Fraxel Laser is based on what's called fractionated technology. So what it does is it pokes little columns of thermal energy under the skin, which stimulate collagen to grow in, and it actually fills in and remodels the scar post-treatment. Post-procedure, there's about 2 to 3 weeks of a little bit of redness, and then you can expect to see results 1 month after the treatment. Usually it's 3 or 4 treatments are needed to get the best results, so most patients do a series of treatments. It's very comfortable. We do local anesthesia, topical anesthesia, for about 1 hour, and then the procedure itself is about 15 minutes, and we use this cooling air to make it even more comfortable. So there's very minimal pain during the treatment. We charge $1,000 per treatment, which is pretty average. Usually it's a series of 3 or 4 treatments, so around $3,000 to $4,000 to complete the treatment. Patients can expect about a 50 to 70% improvement after the series of 3 to 4 treatments. And patients that we see are really happy with the results. They feel more confident. Although it's not an area that other people see often, they see it, and they're kind of happy with the results. After the Fraxel treatment, there's really not much to do. Just normal moisturizer, washing with a gentle cleanser like Cetaphil or Dove soap, and that's it. You'll be back to normal in about 2 weeks, and then you can get the treatment again 4 weeks after the first treatment. Now, after the treatment, it's not uncommon for it to feel like a sunburn for about 5 to 7 days, and then it goes back to kind of the normal feeling, and 2 to 4 weeks after the treatment is when you first start seeing the results of some changes with the texture and the pigmentation of the scar. Fraxel is very safe. I've seen no long-term side effects. The only risk that we see is sometimes in darker skin patients it can cause a little bit of hyperpigmentation. So the area that's treated can be dark for maybe 2 weeks or 6 weeks after the treatment, but it always resolves back to normal. And we sometimes use a lightening cream to get that back to normal even faster. Now, before this laser, there was no great options for C-section scars. The old lasers had higher risk of side effects, so oftentimes patients would hold off on treatment because of that. If you're planning to have more children in the future, I would wait until you're done having children to get the Fraxel laser done for a C-section.